Great. Well, thanks everyone for being here. We're going to jump right in. I think topic here is to build or to buy. And so we're going to get Spencer's insights here of how they approach their M&A strategy. So to start, I think we all have kind of observed M&A has been ramping up for Stryker. $1.5 billion plus M&A last year, $5 billion plus to start the year off with Inari. So the key question, how should we think about M&A going forward for Stryker?
Thanks, Emily. Before I go into answering the question, maybe I'll just share a little context for background. So I've been with Stryker for about 26 and a half years or so in a variety of different commercial leadership roles. Once upon a time was in marketing management, sales management, these type of roles. And we've been really fortunate to utilize M&A as a source for growth. And so it's been a great recipe for us. And that's accelerated and decelerated depending on cost of capital and the environment and interest rates and things like this. And I think over the period of the pandemic, we did, pump the brakes a little, pay down some debt. We had bought Wright Medical, Stryker's largest acquisition at the time, about $5.5 billion. And we were really intentional to say we need to pay some of that debt down and build up the piggy bank again to go after more deals. And coming out of the pandemic, we saw interest rates go up, but the environment has gotten more competitive again. And so we've tried to be really intentional to say, let's go out and turn back on the M&A machine with more aggression. And we exemplified that in 2024, and it's starting to build in some of the things that we've done in early 25 or closed on, like the Inari acquisition in 25. So it's alive and well. I won't share all the trade secrets of what's next, but you can imagine it remains a key aspect to our long-term growth strategy. And we're really fortunate that we built up a little bit of a muscle here in terms of assessment, understanding the right fit culturally. But then at the same time, integrations have become more and more important. So how do you make sure after you acquire the company that we're really getting the value out of it in the right way and preserving, quite frankly, why you bought that organization. And maybe that's as important as anything. We're buying these assets because we love the product, we love the people, we love the growth. So how do you keep that sacred? And, sprinkle in Stryker Gold. And the gold word is, the brand of our color, et cetera, but it's a little bit to show that that's the way we want to shape it as well. So I think, the future will remain filled with M&A. It'll be a key part of our strategy for growth. Maybe one other just context, it's sort of fascinating to see our companies are completely different shape and size than a decade ago. And so the kind of deals we look at now, and even when we think about a tuck-in might be, deploying $5 billion for a peripheral vascular company like Inari. That's more of a tuck-in deal, if you can believe it. Well, 10 years ago, that would have been a bit more of a significant deal, maybe even transformational. Now, it's an absolutely critical deal to build out an adjacency, but it has a little different economic profile in the grand scheme of Stryker. And maybe one of our challenges in that state is the growth that's expected. As a $20 billion plus company growing double digits at the moment, that's a tough order to find assets that can be accretive and bring that value. So expect more of it, but we have to be really thoughtful about what type of deals that we're doing and how those fit into the broader portfolio.
Yeah. And then one thing I think that's unique is how Stryker actually approaches M&A. So how are you kind of structured your BD team? How do you go out and find opportunities? Maybe you can touch a little bit about, your central BD organization versus what you do within some of the businesses.
You bet. Emily, I represent a whole host of really smart, thoughtful, hardworking people that do this every day. And so maybe I just get the luxury of talking a little bit about the model. But we started a long time ago with fierce decentralization at Stryker. The business units were set up even where business unit X would compete with business unit Y, maybe more so than they were competing with the competition. That wasn't ideal. It was really effective in our early days, as I'd say, small to mid cap. But as we've grown, we've realized we have to get value out of working together. And then the question is, how do you keep that specialization? How do you keep that spirit of really understanding customer needs, market trends, and relationships and connections in those spaces, yet bring some scalability, common practices, best practices for fit, culture, scalability, et cetera, et cetera. And I think we've found a pretty good place. So our model as it stands today is we still have this decentralization, this specialization. And in each of these business units, roughly 22 right now, operating business units, they all have specialized M&A, R&D, sales, marketing, and that includes upstream marketing, focused on exactly what that market needs. What's really powerful about that, we have deep relationships of understanding trends, deep relationships with customers, and maybe as important in the M&A realm, deep relationships in companies that are working on innovation in that space. That served us very well. Where we've built probably additional competencies in the center. We've always had a small, and it's still relatively small for the scale of our company, but mighty and impactful centralized BD team at corporate in the center. It's fortunate enough to report into me. It's led by a gentleman by the name of Brian Zanko, who's been in the industry for a couple of decades. One of the great understudies in that world, who's been in one of our divisions leading it and is now in the center, is Chris Terry. He's in the room with us today. And they're looking at both deals that might make sense for broader Stryker because they don't fit in one of those 22. That might be part of their job. It's also part of their job to go, well, hold on. If we're going to buy something in this space, there is some value here to connect into these other parts of Stryker. There's potential overlap, synergies, R&D, marketing, go-to-market, sales, etc. And so having both those teams working hand in hand is really powerful. But still, the magic of what we're able to do is these rich, deep relationships specialized in a marketplace. We have somebody else, Dr. Adam Wallowicz here, in our trauma and extremities business, for example. He wakes up every day, and in those, we have 3 business units. He is thinking about, how do I find innovation companies' value for those businesses? And those general managers are leaning on him each and every day to say, help me find them. So he goes into meetings like this. He was at the Orthopedic Academy in San Diego last week. He's all over the world meeting with various different companies and talking about their growth trajectory and what their future might look like and how might Stryker play a part of that. So you put those together and we've had a lot of success. The last thing that we've built up, it's probably the most recent, is our integration excellence, really a center of excellence around integration in the center. We used to have it all disparate in the businesses, one at a time. We'd do a deal. The people in that business or division would do the integration. They would learn from each other. It's much more centralized to say, hey, here's the playbook, here's the best practices. We still need the subject matter experts in the business, but to make sure that we're harvesting the value, having that centralized group that can deploy resources different ways and really repeat and learn from previous integrations is very powerful. We even created a top 10 where there's 5 things on one side of the sheet that we get to decide at corporate in the center and say, these are shalls. You shall move to an ERP by this. You shall change a building by this. Whatever, branding, these type of things. There's another whole list on the other 5. We give a lot of autonomy back to the business leader. And there's a few wrestling acts that happen on those sometimes. Maybe it's a critical R&D person. We're like, look, we have to keep that person, that geography, that know-how. And so that discussion might come up. And we usually defer back to the business to make that decision, but that's a mature process that's been built in our business. And every time you do these, it's like going to the gym. You're building up that muscle over and over and over. And we don't do them all perfectly. I mean, we do deals that don't work. We don't talk about them a lot, but we do deals that don't work. But you learn from those. And if we're doing our jobs and have the right vulnerability about it, we're taking those learnings and we're building it back into that next integration and best practice.
Yep. And you touched on it, current business today growing double digits. But when we think about market growth and you think about M&A opportunities, how does that kind of impact as you're thinking about different opportunities, end market growth, and how that affects your attractiveness to a certain sector?
Yeah, I'll start with saying we're very fortunate at Stryker to have such strong performance. It's a bedrock of our culture. It's one of our 4 core values, performance. And so we have great expectations and try to be a category leader or market leader in everything we're doing. That's a bit of the marketing strategy. That being said, we're constantly looking at how do we enter markets that have greater upside, either by natural growth rate, or there might be something in the makeup of the population, the demographics, something around the corner that's saying, hey, this is going to be needed more and more and more. And how do we enter these? We do very extensive adjacent reviews. And maybe I'll talk about a real life example that's happened most recently. we announced the closure of Inari Medical. It's right up the street here in Irvine, a peripheral vascular company that we're just thrilled to welcome to the Stryker family. Amazing technology, amazing employees, an amazing mission, and an incredible culture. It lines up exactly with making healthcare better, which is what we do. So you think about all these things and you get so excited. Second, you look at the makeup of the economics of that market. Strong margin profile, really good clinical outcomes. And oh, by the way, strong market growth, mid to high single digits. This business is growing in the teens plus. So really exciting to think about how could we bring that in? Well, we've been studying the peripheral vascular market, I don't know, probably for 5+ years, and with rich intensity over the last 24 months. Deep adjacency reviews, deep dives into the drivers, deep dive into an entry strategy, understanding the risks, the trade-offs, and then you have to figure out what's the right time. And this one worked out that there was an opportunity to get involved, and we obviously executed on acquiring Inari. But that wasn't something where we got the phone call and said, oh, geez, what do we think about this space? Well, we knew this space. We knew it to a T. And it also allows us then to expedite quickly in that process. We know what are going to be the drivers, what synergies would be required, what does an outlook look like, how could this bring value to other parts of Stryker. On that one, just for context, we are a market leader in the neurovascular space, so smaller coils and removal devices for clots in the brain. These are a little bigger in the lung and in the legs, but a lot of competency there and even some know-how that we think we can share over time. So that obviously has propelled our weighted average market growth rate, and we're really excited about that. At the same time, better to be lucky sometimes than good. We've been going through a portfolio assessment where we tried with our core spine implant business for quite some time to say, are there other things we could do to this to help drive market growth and product growth for us? And we haven't been able to see the results that we expected. What happened coming out of the pandemic, we said, wow, the other Stryker businesses accelerated at a disproportionate rate due to volumes, due to innovation, due to some of the strategies we implemented during the pandemic. The spine business did not. And at some point you look at it and you go, well, I can't justify deploying capital there and feel good about it knowing I could put in one of the other businesses to have greater acceleration and rates of return. So we made the decision, could there be a better owner? And come up with some sort of relationship where we can still leverage the relationship in that portfolio, but somebody else can own it, invest in it, have a different risk profile than we can. And so we made the decision to sell our spine business. So when you think about that and the market growth rates, now we're pulling out roughly the same size company as the one we just bought that wasn't growing to one that's growing in the teens. That dramatically helps the outlook for Stryker. Plus the end market itself of peripheral vascular is a much stronger growth rate. It all sounds simple in the rears in hindsight. When you're going through all this stuff, it's complicated. But just imagine the peripheral vascular adjacency that we've been exploring. We have another 6 or 7 with that much rich intel, understanding, passion that we're constantly assessing. Maybe the last thing that I'm most excited about and even relevant to the audience here, what's great about entering in these adjacencies, something like peripheral vascular, you buy this core beachhead asset in an amazing company like Inari, that opens up another 10 doors and another 10 opportunities to look left, to look right, to see how else we can propel that growth. I think it was, only days after we announced the deal that I had a couple of other structured calls with really fascinating innovation companies and technologies in that space. And you go, wow, think about this. These are all areas we wouldn't have ever been able to tap into or think about. And that opens so much more growth for us in the future. So that's the real life example of looking at how do we drive that continued growth. Oh, by the way, and a little bit to the topic of the session, you can't forget about what got you here. And so you have to continue to invest in the core and keep the organic machine going at the same time.
Yep. Maybe a slightly different topic. You touched on it, integration and how you guys kind of approach integration. But one of the key questions is, when do you decide to fully fold in a company versus letting them kind of run on their own? And how does Stryker make that decision across your various deals?
Yeah, it's a great discussion, one we debate as leaders at the company of what's right and when do you apply additional pressure to force it to be more Stryker-like, if you will, and when do you let the autonomy go a little longer? Our bias generally is more autonomy. Don't mess it up. We buy top-class companies with growth trajectories that are strong, with great teams. They know what they're doing. And so we try to empower that and stay behind it. Yet, we go, there's probably, again, I'll use the branding color gold, some Stryker gold that we can sprinkle in on process, on maybe some commercial capabilities, potentially some additional connections, network, and obviously some synergies that we can take out of it. The bigger the company, the more independence we usually offer. Mm-hmm. The smaller it is, it's pretty easy. Put it inside something, make it connect into the machine. Maybe it's more product-based. We work through, how do the people fit into this? But I wouldn't say there's an exact science. It's a bit more of a feel on the needs and what that business is like. We're even sensitive to think about the naming. So as you can see with Inari, it's still Stryker Inari right now. There's brand recognition in that. I say right now, we'll be that for 20 years. I don't know. I sort of joke, I go all the way back for those who are a little more aged in the business like I am. If you go back to the Howmedica Osteonics deal that Stryker did in 1999, there are still people in our business today that refer to themselves, as a Howmedica employee or an Osteonics employee. And you're like, dear goodness, this was 27 years ago, for God's sake. However, on some of our boxes, probably for legal, it still says like Howmedica or I'm like, oh my goodness. So some of that takes a lot of time, but there's not one right answer. It's a thoughtful process to see what that looks like and what's needed.
Yeah, makes sense. One thing that's really top of mind at this conference is AI. Yeah. And a lot of companies' products you've been looking at have AI, some aspect involved. How does that affect
We buy companies with the name in it, Care AI. We bought one, yeah. You put AI on anything, it gets pretty hot pretty quick. Look, I think AI is, it's definitely a very exciting topic that's wildly dynamic right now. And understanding how artificial intelligence can create value in how we provide our products and care is really important. And how do you monetize that value? It might be one of the trickiest aspects. We've been really fortunate that we have some competency that's built organically, that's taken time in something like robotics, where we have some know-how. We've done some investment in companies and bought companies like Gauss Surgical, where the original concept is built on an algorithm that takes a picture of a sponge, how much blood's on it, compares that to, a massive amount of information that's in a data lake that has all these different sponges, as many as you could ever imagine, and compares that and gives more accuracy than, any human eye or measuring tool could provide. So we got competency there and built that up. The recent announcement of Care AI that has a set of algorithms or sort of eyes in the ICU, if you will, in the care environment. So our ability to look in and say, how do we take these technologies, how do we take these platforms, create value with the product or service itself, but then are there other competencies and learnings that we can share across the portfolio? Maybe the best example is when we bought Wright Medical. We have this amazing capability now in pre-planning in the surgical imaging side. It's called Blueprint. It started in the shoulder. And the team that works on this built artificial intelligent algorithms that actually can predict the exact implant you need based off the scan that takes place in the shoulder. It's incredible. You can even do sort of a help button, and you can now ask for what would the top 10 providers, surgeons in the world do for this particular case, all by using AI. It's remarkable. So that competency started in the shoulder and right. Now we're looking at that for all these other disease states, starting with very natural ones, hips, knees, something called prophecy for the foot. And so some of that capability is now being built. I think the challenge for all of us is to make sure, again, that the technology is scalable, that the application is robust to the point that you can acquire it, integrate it, and it has a pathway for more. We run into a lot of companies that might have a circumstance-based capability, but we need it to be able to grow and scale across the world. And so I think that's a really tricky thing. And then the monetization piece of all of it, and just what are the right models for this? And we have various versions and experiments, pilots going on across. Some of our business are set up this way for more of it. Others, I think we're in the early stages. So expect a lot more for AI, expect a lot more investment. HIT's been a really big part of our growth trajectory in an area we've spent a lot of money with CareAI, Vocera, some of these type of assets. And we're bullish. There's a lot more there to do and really amazing technology that can help connect all these different products that we have at Stryker.
We touched on it a little bit, but when we think about leadership position for Stryker within each of your various product lines, how does kind of the competitive landscape, the leadership potential impact your M&A decisions?
Yeah, I would hopefully, again, we're really grateful about our position. I don't want to come across as, too confident in this, but we don't spend a ton of time saying, well, what if they did this? And we're much more, what's our strategy and what's critical for fulfilling our needs? We do, if we get into a deal, obviously we assess what the competitive landscape is, and we'll talk about some of that in our adjacency reviews or our core deals we're looking at. But we're much more focused on that category leadership. How do we build that category leadership? How can we expand the market once we are the category leaders? What more can we do clinically to provide a better outcome, whatever that means, for the pure good of doing good in healthcare? I mean, that is our mission. Together with our customers, we're driven to make healthcare better, and we're very fortunate we get to spend time thinking about that responsibility. So there's not as much wargaming as you might think. Maybe sometimes we carve out a little time to dream big and go, well, what if this happened? And what if Apple did this? Or, we do have some of these discussions, but we try to stay true to our own strategy, and that's served us pretty well.
Yep. I know we've talked a lot about M&A, but sometimes the best decision is to build.
Yeah.
And to, build within, invest within. So how does that decision get made? How do you kind of go about weighing M&A versus internal investment?
Yeah, it's a really important part of our strategy. And again, it goes back to the model of these 7 big divisions, the 22 business units. Those leaders are really empowered to think about their business and what's currently in their portfolio, what's in their R&D pipeline, and then to look at where would they augment that pipeline with M&A and how does that drive additional growth. It's interesting. I would tell you 10 years ago when interest rates were much lower and money was, almost free. Mm-hmm. You could probably take a few more risks and your risk profile was a little different and your results would have a bit more cushion in them. We're a little more selective today. And I think during the pandemic and the slowdown, maybe after 19, we were buoyed up by the success of a lot of M&A we did in 14, 15, 16, 17, 18, 19, which was great. That allowed us to invest deeper in our organic pipelines with R&D and M&A and allowed us to do that in an efficient manner. So we've built up those pipelines, and you hear us use other terms out there about the product introductions we have and sort of the cadence of these, and that's been really remarkable, balancing it with the M&A, but it's driven again by those general managers and those business leaders. I'll share one little interesting story, though. A lot of times the great M&A starts with organic innovation. People love to talk about Mako. Mako is one of, the greatest success stories in musculoskeletal disease. It's had a transformational impact on the world of orthopedics, et cetera, et cetera. And we're super grateful for that opportunity. Yet when we bought Mako, what we don't often talk about, there was another internal project going on, an organic musculoskeletal robot. It had a special name. It had a special group. They were chipping away at this. They were working like crazy. And they had a ton of passion that was the robot that was going to show up on the market and win. And a lot of times what happens, we will do this. We'll put money into the organic innovation. We'll chip away at it. We'll look. And then eventually you go, all right, take your head up. What else is out there in the market? There's that one. And for whatever reason, in the case of Mako, we really liked the IP portfolio related to the haptics. That's one of the greatest differentiators, the ability for the robot to know where it is in a plane at any time. That's a really strong differentiator. If we can take that and add it to our know-how and put these together, organic with inorganic, watch out. Game over. And you've heard the stories, or some of you might have had a lot of naysayers when we first bought it, but it's proved out to be a great platform for us. But I think that's a really neat example of where you do the organic investment. And, we have another 20 of these going on in the company right now. And then you go, how can you augment that with the right acquisition to supercharge your position in the marketplace?
Yeah, it's all about being flexible and having that ability to pivot.
I think so. A lot of that is still driven, though, by that expertise in the division or the business unit. Interestingly, in that particular example, the world of orthopedics plays in a few different places. So there was a lot of gnashing of teeth as the different businesses that had products in that. And there were some winners and losers, if you will. If you talk to some of our employees, they go, well, I was on this side. That didn't feel as good. This side felt really great because they went on. And sometimes we have to make those tough decisions, as tough as that can be.
Yep. Maybe last question. At this conference, there's a lot of founders. There's a lot of great companies out there that maybe would consider a strategic opportunity with Stryker down the line. What is one of kind of like the missteps you see perhaps, or advice you would give folks that are, thinking about potential strategic opportunities with you guys?
Yeah. Look, I first off want to thank every founder and all the teams that are working on startup technology. The belief of innovation is growth. Innovation is built on trust. This is the foundation of how we continue to solve big problems in healthcare, period. And admittedly, in big companies at times, that can be hard. I mean, we do lots of amazing innovation. And if our 55,000 employees were here, I'd say the same to them. But we also rely on the startup world, on the incubators, on the dreamers, on those that are willing to take the risk. That's absolutely critical. So thank you. Keep it up. Stay at it. And companies like us depend on it. So I think it's really important. If I was to give advice, I would say be appropriately committed and persistent, but not, annoying. And I think there's a fine line there. But I understand. I mean, you have great pride in what you're working on. You have amazing technology to talk about. It's figuring out the right avenue into a big company like Stryker. I giggle at times. So Kevin Lobo, who's, borderline like a famous human now all over the world, at least in the world of med tech and a lot of industry. I mean, he'll send me a note. You still have somebody that he met in, Japan last week saying, yeah, I've got this little thing that I, started on my workbench and I'd like to sell it to Stryker. You're like, that's probably not the entry path to get that product sold. Kevin loves the great technology as much as all of us do, but there's probably another way. And so it's just figuring that out. So I actually think coming to conferences like this and connecting with our people the right way and having these discussions and then having realistic, pragmatic thoughts about how that relationship grows and works together. Another little nugget would be take feedback from the strategics. Ask that question. Hey, what do you look for? What can we help? What can I change in my business? We sometimes see it's gotten better, admittedly, in I'd say the last half a decade. We need robust quality systems. We need robust compliance. We need robust, processes and systems in the business. There's too much remediation if that risk profile gets too far over here. But the best thing a founder can do is ask that question. Like, hey, what do you think about this? Are we building this the right way? Sometimes that's hard because it costs more money, takes more time. But that's a better end result if you're in the position of a big strategic.
Yeah, great.
Yeah.
Well, thank you so much for the time, and we appreciate everyone coming, especially end of the day. So.
Yep. Thanks so much, everybody. Thanks for taking the time. Thanks, Emily.
Thank you.